Hi everyone. As you know, with this cycling trip, I'm supporting organization Stichting Bootvluchteling, which is an NGO, a non-profit organization that is active at the borders of the European Union, providing medical and psychosocial help to people on the move. So I'm very happy today to have here with me Christos Nicolaidis, who is the area manager for Lesbos for the Stichting. And Christos, thank you very much for joining. Could you tell us for start something about yourself and your role within the organization?
Absolutely. Thank you very much, Yorgov. Thank you for the initiative and for the invitation to participate in this wonderful initiative, very much needed and timely. My name is Christos. As Yorgos said, I'm the area manager or a field coordinator in our humanitarian terms here in Lesbos. My day-to-day job is overseeing daily operations of Stichting Bootvluchteling or both refugee foundations, medical and psychosocial support activities here on the island of Lesbos inside the close controlled access center of Mavrovouni, as the location of the refugee camp it's called here. And we try to ensure that our teams, volunteer teams of medical and psychological professionals, provide compassionate and high quality care in difficult at times circumstances, day in and day out, 365 days a year. So my role focuses more on the administrative and coordination tasks, as well as overseeing operations and the team composition, if I can say, in dynamics.
Okay, thank you very much, Christos. And I'm curious, what personally motivated you to get involved in this work?
Yeah, absolutely. And this is, I was not also sure 100%. I have a background in political science, and then obviously I was following the situation. I was not based in Greece, even though I'm from Greece. I've been born and raised in Athens. I was following the situation, and then I had an opportunity to come to the island and volunteer for a month. So I guess it would be overall interest in the area, and then being Greek obviously had affected us overall. It was all over the news and so on and so forth. So I found this chance to come and volunteer, and that was a life-changing experience, very much so. But if I can answer the question specifically, I think during this month, which 1 month became 2 months and then became 3 months, and then I started working, if you like, in this field. So up until then, it was a volunteering experience. Something that resonated very much, and I think was the motivating factor, is seeing people in very, very hard circumstances. Now we're talking about over 20,000 people living in terrible conditions back in the infamous Moria camp. Who always We were doing some community center recreational activities at the time as a volunteer. And I remember the perseverance and the big smile and the big resilience that people actually have. And I think that was the main motivating factor of me not necessarily coming here, but after I came here, the reason that I stayed and I wanted to continue doing this is you could see people who lived in very, very, very bad circumstances with a lot of uncertainty, limbo, staying in a year and a half, 2 years in terrible conditions in a camp without knowing exactly what's going to happen next. And still, they were coming to us with a big smile, a big thank you, and a big see you tomorrow. Yeah, which I think was the main motivating factor.
Thank you, Christos. And can you explain who exactly the Stichting is supporting and in which areas you are active?
Absolutely, yes. It's been now 10 years since the European refugee crisis, as it was called back then. Now, terminology has changed, obviously, a bit, especially in the European news outlets and as such. But basically, it's people who seek asylum people who flee war zones, conflict areas, with majority of people coming from areas such as or countries such as Afghanistan, Syria, the Democratic Republic of Congo, Yemen, Eritrea, Somalia, Sudan, and so on and so forth. These people come to Europe to seek asylum, to seek international protection, as they're fleeing from persecution, political or otherwise. And this is the people who BRF tries to support, or Stichting Bootvluchteling, as well as in the beginning of the crisis, if you like, many other also people try to support. Now we're not that many organizations or initiatives, given the difficulties of the overall context, I would say. And we try to support. Stichting Bootvluchteling has tried to support in a variety of ways. In the last, I would say, like 5 years, there has been a particular focus on medical support to provide access to healthcare services, as well as mental health and psychosocial support programs that basically fill in the gaps of the state or of the inexistence / inefficiency of state actors to provide those. So it's people basically who fall into a status of an asylum-seeking person, who are still in the process of asylum, and some of them even after the process, while they're residing in these closed, controlled access centers, as they're called, refugee camps with high fence and walls and all of that, who have very limited access to services, to no access to services at times.
And Christos, what are the biggest challenges that your teams currently face on the ground?
Yeah, I would say currently overall the biggest challenge, and this has obviously changed, or I would say the importance and priority has changed over the last 10 years. You had a situation where there was complete crisis mode, where the biggest challenges was capacity, for example. When you had 25,000 people living in the camp, capacity was a big issue. What has always been a consistent challenge is external challenges such as political and legal landscapes, limited resources of state actors, and then after 10 years, it's one of the big challenges is also the willingness to support. In 2015, 16, 17, there was willingness to support, and there were a lot of resources also, both monetary and human resources being deployed. While now it's a forgotten crisis, it's a forgotten prolonged crisis, you could say. And after the variety of events that happened worldwide, starting from the invasion of Ukraine in 2020, the pandemic, now everything that happens currently, there is way less way less resources being deployed. Awareness is less, which basically makes it very hard to advocate and speak for change, while at the same time you try to cover gaps that are existing for the last 10 years non-stop without any improvement. So I would say, despite a variety of challenges existing on a field level, as we do, I think the main one goes into a political and legal landscape, which makes the work less visible and thus limits the potential sustainability of it and the potential chance for a change in what the circumstances are currently. So I would say that this is, like, from everyone's perspective, I think this is the main overlying challenge.
And Christos, if you would have to wish something that more people should understand about the situation at the European borders with respect to refugees,
Yeah.
what would you wish that people understand?
Absolutely. And I think, thank you for the question, Yorgos. I think something that, I mean, I also encountered, and I think I've slightly changed my mind and perspective of these things, especially how, especially currently in the political field in Europe, in all our countries, from Greece to the Netherlands to other European countries as well. There is this false narrative and perspective of how lives and people are being described as. And I think something that would be definitely good for everyone to understand a bit better, or start thinking of, is we started getting into this globalized world, right? Interconnected world, basically. Um, and I think it is very important to highlight that the people that come here flee their countries of origins not because they want to leave the place where they were born. Most people don't want to do that anyway. They do this because they're forced to, in many ways, for protection, for the protection of their kids, for a better education potentially, for fears of their lives and to find safety somewhere. And all of these reasons happen not only because the countries of origins of people, cannot properly provide this to their citizens. It's an interconnected system in which our privilege and safety, if you like, can at times cause others not to have this privilege. And I would say this is vital to understand that it's still people. It's not as it's portrayed. A lot of our politicians and a lot of the media portray people the way that suits them and not how the reality actually is. And I think people should look beyond those labels or big announcements in media of, we're being bombarded or we're being invaded, as it's been called a lot of times. It's not the case. The numbers of people seeking refuge in Europe now are very, very low compared to how many people, for example, go to Jordan or go to Lebanon or go to countries nearby their countries of origin, or Turkey even. And yeah, and to look a bit beyond the headlines.
Thank
I
you.
think that's vital. Yeah.
Is it possible to give us an example of how your work makes a tangible difference in people's lives? Do you have any example you could share with us?
Yeah. If you, I could talk for days honestly about this. Um, yeah, I can start by maybe like super briefly saying that Stichting Bootvluchteling in the last, since the Moria fire that many of you probably know, in 2020, September 2020, the infamous Moria camp caught a big fire which destroyed the whole camp, thankfully without um, any human suffering in that sense. And then there was a new camp built, which was built in an environment that wasn't really appropriate for a camp setting or for people to live in. In any case, during that, there is a state-provided clinic, a doctor, basically, who at the time, there were two doctors needing to care for a population of over 10,000 people with very limited resources themselves, both from education, both in terms of capacity to interpret, so interpretation services, and so on and so forth, and of people who have suffered both traumatic experiences as well as who haven't had access to proper healthcare in the most of them at least in their journey to here to Lesbos. And then having to manage all of that within a 8-hour framework of a day, 5 days a week, to people you can imagine is almost unbearable to do. And this is one of the important things that BRF does in terms of what we cover. We're there every day after the state doctors leave, so from 5 until midnight, 11 o'clock, depends on the time. In the past, we've been also all around the night, night hours, which basically we support on a daily basis, weekends, public holidays, 365 days a year, as I said previously. And during those, you see that if, for example, we were not there, people would, for even not acute matters, not emergency matters, they would go to the police, which is responsible after hours for the population and their safety, and then they would call an ambulance. And the island of Lesbos has four ambulances, for the whole population of 80,000 people that they have on the island, with a stretched local healthcare system and a hospital which has certain services, but it's not also super functioning, if you like, in that sense. So you see, we have, for example, or our medics have given birth while the ambulance was on its way to come to pick up the person, take them to hospital. A variety of such small little cases which do make a difference, especially when you know that, okay, you can think of if we were not there, present at night in our little clinic inside the camp, what could have happened. And in many, many times, unfortunately, that could have been loss of life. From a pregnant lady, as I said, to a choking baby we had the other couple of months ago. Blue baby choked because something went wrong in the digestion process. And if there wasn't medical professionals at that time in the camp, there would have been a loss of life. So I would say this is one of the important things that we do. We're there not only to provide this access to healthcare and even like save lives without, I don't want it to sound catchy or something, but it is actually true, and everybody should have access to this, but also to bear witness in a variety of these cases that you wouldn't know about if people like our teams or organizations like BRF do, basically.
Thank you, Christos. I would like to ask you now regarding the donations, and because I raised also a donation for Stichting Bootvluchteling. So, can you tell us what is the impact in real terms? I mean, how do the donations from privates impact your work?
Yeah, first of all, to say that thank you again for the initiative. Unfortunately or not, NGOs and the whole ecosystem is dependent on financial contributions. It's not a profit-making machine. So in this case, you need resources to be able to employ people, to be able to purchase medical supplies, which is, for example, a lot of the donations go to the medical supplies, to sustain costs for volunteers, to sustain local staff like interpreters, and to ensure continuity of care. To give you an example, in Stichting Bootvluchteling, I've been now with the organization for a bit over a year. We have a daily attendance of over 50 people per day, so 50 times 365 days. And this obviously varies depending on the season, depending on how many people reside in camp, depending on the availability of the camp doctor, and so on and so forth. There is certain, but I would say like an average of over 50 people per night who, through this medical consultation or even mental health psychosocial support consultation, receive a full holistic approach. They receive a safe space, friendly staff, which is also not our forte, if I can say, our how do you say?
Strong point.
Yeah, exactly, of Greeks, Greek state employees and as such. And this is something very true, which has also been noted by a lot of patients, that we provide a safe environment, a welcoming, safe environment, so that then you get a consultation, you get a follow-up, and you get whatever medication you would otherwise pay yourself, or you would pay part of it because the other part would be covered by the insurance, social insurance. All of these things you would get basically, and this is where the money goes to, or this is where the donations go to. At the same time, you have support teams. So we have advocacy efforts which try to make some change. And there have been instances where advocacy activities did make a change, significant change also, is the bearing witness and then advocating for change, which has small concrete steps, but still. So basically, donations go towards that in terms of impact. Now, I would say overall, during the last 5 years in this new camp, I'm not even going to speak about Moria times, because this, I think the impact was a lot more then, because of the amount of people that resided back then in Moria. But you have situations where we see approximately all patients or all residents of the camp who require healthcare, access to healthcare, who require a doctor, come at BRF's door. And then from then on, there is an appropriate ensurety of continuity of care through the hospital, making appointments in private clinics if needs be, covering costs of those, special medication, chronic medication, transportation to Athens where there is the specialist, an endocrinologist or a neurologist, for example, they don't have in this island, and supporting people through that process full on, holistically. While otherwise, for example, you would have the typical, and I'm not sure, Yorgo, if you remember from the time in Greece, ping pong. You get sent there, then you get sent there, then you get sent there. Nobody knows, nobody has translation services in any way, interpreters or intercultural mediators. So people basically, after a point, they get fed up and the issue is not solved. So this is where donations go to. If I can give, I did a very small calculation of what our programmatic field budget for Lesbos is, incorporating also costs of indirect costs of our HQ, advocacy activities, the admin support, and so on and so forth. And if you take that number and then you divide it by the number of consultations we do per year, it's approximately 25 euros per consultation, which if you go to a private clinician, a GP, for example, service, it would be at least 50 euros without, just to be seen, without any follow-up. Yeah. So I'm not sure if I answered the question, but this is a bit of a breakdown.
No,
for example,
absolutely.
25 euros a full-on consultation plus the support environment around it.
Thank you so much. Thank you, Christos.
Okay.
Now, I would like to ask you, is there any message or call to action you would like to share with people that are following this project?
Yeah, absolutely. And thank you for bringing that up. I think, as I said originally about my motivation for it, I think, we're being bombarded by changes, geopolitical changes, technological changes, a variety of changes, especially here in Europe. I think the message is, we should not look away at things that happen because we're bombarded by other things, or because it's a 10-year crisis, or it's not talked about, and so on and so forth, because these are others, the whole other thing. We live in an interconnected world. We benefit from it as well, very much so. So we should not see the others as just other strangers. There are people who had no choice but to flee, basically. Like, we would do the same if we were in their positions. And as a result, we should not look away, and we should try to do whatever we can. It doesn't need to be a monetary donation only. It can be volunteering time. It can be simply, writing an Instagram story about it, or resharing a post, or talking to our friends, talking to our family, to create or to continue creating and boosting and engaging this part of a network of solidarity, if I can say. Because at the end of the day, these lives matter, and they matter not just because it's others, or because someone has a humanitarian mindset, as they say, or otherwise. They matter because they're the same as our lives. So we're all on the same page. Somebody gets it now, somebody might get it in the future, or whatever. But I think the point is that we are all one, and we should all have at least the same access to some basic things. And the fact that we have it does not mean that we might not lose it. And we should try to do what we would like others to do for us, rather than ignore that completely and call it others, or look away because we have a lot to manage already. A call to action basically would be that. Don't look away, and try to do whatever small things you can do.
Thank you. Thank you, Christos. And a last question. What keeps you hopeful in the face of such complex
Yeah,
humanitarian challenges?
yeah. Again, I will refer back to to my first answer, which is you see like people in very, very, very difficult circumstances at all times, and you still see their strength, you see their humor. You know, they come to the clinic and you play little games. They're like or I don't know. They come one day, they come next day, they say hi, just for a hi. They don't even need a consultation. They still say hi, and through that you see the perseverance that people face, that people have. Sorry, in the face of unimaginable hardship, especially for a lot of us, it is unimaginable hardship. So it's the people, I would say, that we serve. And then the second point is initiatives like this, or the volunteers that we have here in Lesbos. We have, I think it's 15 people now. The energy and the compassion and and the moral compass and energy that they come to volunteer and support with, taking their holiday basically to come and work, volunteer. Yeah, I would say this is the two things that keep me hopeful, which is people oriented, both of them.
Okay, thank you very much. Thanks a lot, Christos, for taking the time to chat and share what's really happening on the ground. It's been super eye-opening, at least for me. And okay, to everybody that saw that, I hope that thank you and for being part of this journey. And yeah, thank you.
Thank you.